Hello, my name is Sinos and this is Work and Wonder. Welcome back to my channel. If you are new to my channel, please make sure you subscribe and click the notification bell. Anytime I post a video, you'll be notified and then you'll come straight here and come and take a look at whatever video that I have posted. So over the few weeks, I started a series on the mental health Osce, and I must say that I'm getting a lot of messages. People are commending what I'm doing and I'm very much appreciative of that, especially those that are in to take the mental health Osce, because there is not a lot of videos on YouTube and they find my videos to be educative enough. Thank you very much for the comments and then the emails that you have been sending me. As I said, I've started the mental health Osce. I have a video on assessment, and then I also have a video on reminiscence therapy. For the assessment is the overview, and this weekend I'll be shooting the real one. I'll be shooting the practical one. I'll be doing the depression and then the mania. But today is just a quick one. I'll be talking about the 6 common mistakes that people do and then they get a referral in the various stations. If you don't do these things or you forget to do these things, mostly they are going to refer you, or you will come back and write that particular station, or they are going to fail you. So please make sure these mistakes, you avoid doing them. The very first one that I'll be talking about is the hand rub techniques or the hand wash techniques according to the WHO guideline. First of all, some people do not do it. Sometimes it may look as if you have done it. If you are not too sure, make sure you tell the assessor that you forgot you would have you were supposed to do this, but you forgot to do it, and then the assessor may consider you. So the hand rub technique, according to the WHO guideline, make sure you do it correctly. Some people too will be doing it, or they'll be saying something else and then be doing something else. Make sure you are consistent. If it is palm to palm, make sure you are doing it that way. If it is palm to back, make sure you are doing it. If it is finger interlace, if it is finger interlock, if it is rotational rub of the thumb, rotational rub of the thumb, of the fingertips, of the wrists, make sure you are doing it as you are saying it. Some people will be saying something else and then they just do something to represent something. Be very careful about that, because the examiner will be watching you. So if you are saying it correctly and then you are doing it wrongly, the examiner can also fail you for that. So take note of that. So hand rub is the very first one. Don't forget to do it, and then make sure you also do it right. Then the second one is allergy. Anytime you approach a patient, especially in medication situations, in implementation, in suppository, even in assessment, make sure you ask the patient for allergy, whether the patient is allergic to anything. And then once the patient says yes, then you can go ahead and give the patient some reassurance that if it is on admission basis, you can say that throughout the admission, nothing that contains that particular allergy or whatever the patient is allergic to wouldn't be provided, be it in the form of food or in the form of medication. Please make sure you ask for allergy. People do forget about that, and that can also fail you. Then the next one I'll be talking about is the scene safety. Some people just patch into a patient room and then they are just going. Especially in a mental health situation, you don't do that. When you are going into the patient room, the very first thing, of course, you have to seek consent. And then if even the consent is granted, once you enter into the patient room, you have to make sure that you assess for scene safety, whether the scene is safe for you yourself and then for the patient. And if you are also with somebody else, whether the scene is safe for you yourself, whoever you are with, and then the patient is very, very important. And that one, as you do it, you look around. You don't just say, I've assessed for scene safety, or the scene is safe to approach, and then you just go in. No, as you are doing it, you have to be looking left and right, at least, to make sure that there is nothing that will cause harm to you. So scene safety is the third one. Then the fourth one is the name. Name here has failed a lot of people. That's number one, is confirmation of name, especially in implementation or in suppository, where you would have to confirm the patient's name, whether it is the actual patient. In fact, in almost all the stations, you have to know whether you are with the right patient. So mostly you have to confirm the patient's name. You read it out and then you say that indeed I am with the right patient. But some people just come in at a point. The first part they may do it, but the second part they may not do it. I've had people who have failed because, especially for implementation, the first part they confirmed the patient name, but when they came back to give the medication, they did not reconfirm that is the patient, that same patient they are with, and based on that, they failed them. So please make sure you always confirm the patient's name. Read what you have on the sheet, or if in most of the adult nurses situation in the hospital setting, the patient have wristband, you can also confirm with the wristband that indeed you are with the right patient. So name here is very, very important. And sometimes aside the confirming the patient name, when you also come in, you can also tell the patient, maybe I am nurse ABCD and I'm here to do this and this and this. So on the patient part, very important, and then on your part is also important. Then the fifth thing is the killer among all the mistakes, that is recording what you have done. It could be your name. It could be, for the first one I'll talk about is your name on the sheet. But nowadays, mostly they will tell you to write your name on the sheet before you even start. But in some exams room, they may not tell you. So when you get the sheet, make sure you put down your name first. And then the very important thing is the recording of whatever you have done. Let's take implementation, for instance. Implementation sheet, there's a place where you as the nurse who is administering the medication, you have to write your name. And then when you get to the medication that is due your time and you are supposed to administer, after administering, there are boxes that clearly indicates what you're supposed to. Some of them, they will tell you to put your initials and your signature and then the date. So always look at the instruction. If it says that put your signature, the date, make sure you put the signature and then the date. If you don't write, you give the medication and you don't sign, and then you don't also write the date as per the instruction, that is a complete fail. Because what is the evidence that you gave that particular medication? So the recording is very, very important in implementation, especially, and then in physiological ops, that is vital signs. After taking your vital parameters, your BP, your respiration, your pulse, make sure you record it at the right column. In recording, don't just record it, but make sure wherever you are recording it in is the right column that you are doing your recording. If you fail to record, that is a total fail. There is no negotiation here. You just failed if you don't record. Because if it is not documented, then it is not done. Then the last thing I'll talk about is quite funny, but a lot of people have been failing for that. That is time in physiological ops, especially with the when you are checking the pulse. When you put your hands, you are supposed to count for 2 minutes. 1 minute will be for the pulse, and then the other minute will be for the respiration. Make sure you count the complete 2 minutes. People have failed, and then the report count back, and then they say that the person counted for 1 minute 57 seconds, 1 minute 55 seconds. It is very painful when you are able to do everything, you record everything, but then they say that you did not count for the number of minutes that you were supposed to count. So this is the trick. When you start counting, let the assessor know that you have started counting. What you can do is, for example, when you put your hands on the pulse and then you feel it, you can say that I can feel the pulse and I will start counting now. Basically, this Osce is about you are doing it and then you are talking at the same time. So once you put your hands and then you feel the pulse, just tell the patient that I can feel your pulse now and I'll start counting. And you start counting, and then the watch or whatever, the time that they normally post there, you can see it. So you can, if it is, let's say, at 4 minutes 30 seconds, then you can count down to about 2 minutes 30 seconds. That will make the 2 minutes. So you can always use the watch. And then nowadays they even provide watches for you. When you get there, there is these small watches, the breast watch. You can pick it up and then you'll be looking at it. And once you start counting, the assessor will also start counting to make sure that you all get that, or you count for that complete 2 minutes. So please make sure you count for the complete 2 minutes. So anytime you are going to start counting, say it out loud. Let the patient know you've started, and then the assessor will know that you've also started counting. The reason for this is that if the assessor says that you did not count for a complete 2 minutes, and now they go to review the video, they are going to start from the point where you said, I can feel the pulse, and I've started counting till you stop counting, and then they will be able to determine whether you actually counted for 2 minutes or you did not count for 2 minutes. So please make sure you always voice it out so that once they fail you and then you go for a review or an appeal, they will be able to use that as a starting point. And then basically, you if only you counted for the 2 minutes, then definitely they have to pass you. So these are some of the mistakes that people do, and then they fail their stations. Some of them are, as I'll quote, silly mistakes, but then it will be very painful if, for instance, you're able to do everything right, but then they say that you did not count for 2 minutes, or you're able to do everything right, and then you could not sign your name. And then before I sign out, the very last one is also under timing. Make sure you practice as many as possible so that you'll be able to beat time, because all the stations have time. Some people are not able to complete theirs, especially implementation. They are not able to complete their tasks within the 15 minutes that is given them. And once time you are not able to complete and then time elapsed, that is a complete fail. So make sure you practice as many as possible, and then you are able to beat time at any point in time. So basically, that has been the video for today. Please make sure you subscribe to my channel. This is Work and Wonder, and my next video I'll be posting will be the assessment for the mental health Osce. I'll be doing both depression and the mania. So please make sure you subscribe to my channel, and then you turn on the notification bell. Anytime I post a video, you'll be notified. That has been the video for today. My name is Enos, and see you in my next video.